Health care delivery system in India. Hello, I am Parikar Priyanka. My topic name is Health Care Delivery System in India. That is a part of the hospital and clinical pharmacy. Introduction. Healthcare Healthcare service in general are rendered by the government throughout a network of health centers from the grassroots areas to the block level. In the rural areas are throughout hospital, dispensaries, maternal, child health and family welfare center in the urban areas. The hospital in the subdivision, taluka level, district level, etc. provide the referral service to the infrastructure in the rural areas. There are also voluntary and private agencies which are functioning to deal with the health problems of the peoples. That is the health care service. It is to solve the different problems of the peoples related to the disease. Then next is a system healthcare system healthcare delivery system in India unit is a 28 state, 7 union territories. State are largely independent in the matter relating to the delivery of health care of the people. Each system has been developed. It is a own system of healthcare delivery, independent of the central government. That is the central government that is a provide the healthcare delivery system. In responsibility consisting many policy making, planning, guiding, assisting, evaluation, and according the work of the state of minister. Definition health systems. It is intended to the deliver health service. It consists of the different planning, determining priorities, mobilizing and allocate resources, translating policy in the service, evolution and health education. It is a health system. It is a reduce the disease activity in human being or completely destruction of the disease. Then next is a healthcare service. Healthcare service, it is defined as a multiple service rendered to the individual, families or communities by the agent of the health service or professional for the purpose of promoting, maintaining, monitoring of the restoring health. Healthcare delivery system. Healthcare delivery system, it is defined as the aggregate of the institution, organizing and person who enter the healthcare system, who has responsibility that including the promoting of health, prevention of illness, detection and treatment of the disease and rehabilitation. That is the definition of the hospital. At the central, that is a 3 point important at the central healthcare organization. At the central comprise the three organs, that is the first is a unit ministry of the health and family welfare, second is the decorate the general of health service, then third is the central council of health and family welfare. Next is a Union Ministry of Health and Family Welfare chart. First is a Cabinet Ministry of State. That is the important part in the Union Ministry. That is Cabinet is a chief minister, chief member of the Union Ministry. Then second is a Deputy Health Minister. Deputy Health Minister is divided two parts: Department of Health and Department of Family Welfare. First is the Department of Health, Health Secretary to Government of India. Divided the Joint Secretaries. then deputy, and the last is administrative. Then the second part is the Deputy of Health Minister, Department of Family Welfare. It is divided to the Secretary to the Government of India. Then third is the Additional Secretary and Commissioners, that is called as the F.W. Then last is the Joint Secretaries of the Union Ministry of Health and Family Welfare, that is the Cabinet Ministry of Health chart. Then next is a organization and functioning by the leaflet presentation. It is a organization and functioning, it is a presented by the leaflet, that is a documentation program. Then next is a the Directorate General of Health Service. First is a Directorate General of Health Service is divided into Director General of Health Service, and these are the divided Additional Director General of Health, then Deputy Directorate General of Health Service, and last is administrative. Then next is a organization. The Directorate General of Health Service is the principal adversary to the Union government in both medical and public health, a team of deputies and a large administrative staff. The directorate comprises in 3 units, example medical care, hospitals, public health, and general administration also included in the organization. Then next point is functions, that is the different function also included in the organization, hospital organization functions. The first point is a general function and service planning, coordination, programming, and appraisal of health matters in the country. Then the second is a specific functioning are international health relating and guarantee. Then second is a control of drug standard maintain. It is a important point, control the drug standard, that is a control the adverse drug reaction of the drug, then the control the drug side effects, then the control the drug addiction, drug habituation, that is the point of the control standard. Then the next is a medical store depot, that is a part of the drugstore and business management. Then the postgraduate training or to the different categories of health person, the postgraduate and training, that is a important part, that is a knowledge is a very important. Without training not a person is a successful in the health systems, though training it is a very important, that is a medical faculty or pharmacist faculty, that is a MD doctors or pharmacist or nursing or surgeons also important the training. Then the next is a medical education and research. Next is a central government health service provided to the all peoples. Then the next is a national health program, that is included in the WHO central health educations. Next point is the central counseling of the health and family welfare, that is one of the most important Union Health Ministry chairperson. Then the next is the state health minister, that is a member at the state level. State Minister of Health. First is a Minister of Health and Family Welfare, State Health Minister. The next is a Deputy Minister of Health and Family Welfare. Next is a Health Secretary's Health Secretary. Next is a Deputy Secretary's. Last is a administrative staff member at the state level, State Ministry of Health. In the Ministry of Health and Family Welfare, State Health Minister, it is divided the Deputy Minister of the Health and Family Welfare. These are the important administrative staff. It is a development to the health, develop the health and reduce disease activity. Then next is a State Health Director. Two separate major departments, medical and public health, are functioning in the state. The Directorate of the Health Service or the Directorate of the Medical and Health Service, the Directorate of Health and Family Welfare. At the district level, there are 597 districts in India. That is one of the district is the Daund. Within each district there are 6 type administrative areas. First is a subdivision, second is a tahsil, third is a community development blocking, fourth is a municipalities and cooperations, fifth is a village, and sixth is a panchayat. Next it is a pyramidal chart. First is a central hospital, then provincial hospital, third is a district hospital, fourth is a urban and rural health centers, that is a progressive health care delivery refer system. Then fourth point is a community health center level. In each the 1 lakh with 30 beds and specialists in surgery, medicines, obstetric and gynecology and pediatrics with X-ray and laboratory facility. The hospital, the present organization of health service of the government sector, consists of the rural hospital, subdivision hospital, district hospital, specialist hospital and teaching institutes. Then the health insurance. It is a present limited to the industrial worker and their families. Industry provide the health insurance to the all workers because the industry, for example chemical industry, in the harmful drug can be used. Then the harmful side effect is a form. Then some workers are suffering the different causes or different disease. So different industry can be workers provide the insurance, health insurance. In the central government, employees are also covered by the health insurance under the banner central government health scheme. Then the employer state insurance scheme also provide the all workers. Then next other agencies. Other agencies is the first defense medical service, second is the health care of railway employees, then problem in health care delivery system, insufficient standard to ensure quality, minimum participations, poor coordination and equitable distribution of service, inadequate collaboration among the provide the service. Then next is in India healthcare delivery system represented by the 5 major sector. First is the public health sector, that is the primary health care. Next is the hospital, third is the health insurance scheme, fourth is the other agencies, then second is the private sector, next indigenous system of medicine, then voluntary health agencies. Next is a national health program. National health program in the different eradication program, national eradication program, national leprosy eradication program, national guinea worm eradication program, polio eradication program, That is a program. It is a very important because the programs also provide the information about the disease or about the guidance the disease or health. Then next is the control programs, national filaria control programs, tuberculosis control program, also the diarrheal control program, cancer control program. That is a different programs included in the national health program. Next is a many thank you for the watching my video.